I don't think the
We're
world is ready for this
back.
episode. Truly and honestly. I don't think you're
I'm
ready
not
for
ready for this
this.
episode. I have no idea what's going to come out of your mouth today. I was just going to talk about, you know, some relatable things maybe. I don't know where this is going. If you're
Okay.
listening to this on the day of its release, happy 420, blaze it.
Amazing. So I pre-gamed our episode by getting really high today. Just kidding, but I'm not. Because I actually was very high today. Let me explain. So
40 seconds in.
I do what I do,
I
baby. Okay.
can't.
I am who I am. So what had happened today was I had a dentist appointment. And here's where I want to kick off our conversation because I do actually have a point to this. But then I'll share some funniness that happened while I was very high at the dentist. I think that we think about drugs in such a narrow way. Like we talk about it like purely just like pharmaceuticals, as in like the opioid epidemic, or like, like, oh, don't get addicted to Oxy when you have surgery. Or we think about drugs in the like when you do shrooms for fun, right? Or like these like very narrow ways. It's like you're either an addict or you do hella drugs, like hella party drugs. And if you can hear the
Mm-hmm.
background, it's my demons once again, the feline variety this time. But we don't talk enough about drugs for sure. We could have a whole conversation about medicinal uses of cannabis and da 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 da. But I really want to focus in on drugs for just like non-extreme uses. So back to my
Mm-hmm.
point of being at the dentist, right? Like I have friends that like go on spiritual quests once a year and they do shrooms in the forest by themselves and they have like this whole yearly thing, right? I also have friends that don't do anything. I also have friends like I feel like I really have friends that kind of run the gamut. But I genuinely like it wasn't until mm, maybe last year that a dentist was like, okay, a couple of years ago, a dentist was like, hey, like maybe some Valium would be good for you while we do like this work, right? But last year,
Tight.
I had a dentist be like, hey, do you want just nitrous while we do your stuff? And so I said, okay, nitrous for what stuff? And they were like, I mean, anything that you want it for. And I was like, what? You can just like ask for that? And so today I have huge dental anxiety. I haven't talked about it on the pod. We will do an episode about oral health. It will not be boring, I promise. But that shit's messy as hell. The inside of our mouth, crazy. Anyways,
Disgusting.
anyways, so today, because I now know this, I was like, oh, and can I have nitrous? And they were like, yeah, okay, sure. Bro, I was having the time of my fucking life, okay? For someone that has such severe dental anxiety, so much so that even with the nitrous and a great dental office, I love this dentist, by the way. I will ride or die for this man. I think I've found
First shout out.
first shout out Dr. Patel. Hit him up for all your dental needs. But even with all of the good things going for me and nitrous, my dental anxiety is so bad that my aura ring clocked this as a stressful day. Like it literally was like, hey, like afterward, because my dental anxiety is so bad. And I think about all the time that I spent, especially when I was younger, like suffering in dental chairs, not going to the dentist, not taking care of myself because I was just like scared for the pain, right? Like, and it was so avoidable, so avoidable, so much so that I had a filling, like a pretty, like two teeth, like on the interior. Like I had to replace a filling that had popped off, and I got fitted for a
Ugh.
crown, and I got a kept crown put on. I got all of that done, and the gum checks and all the huge, all of that done with zero pain. When I say zero pain, I really do mean like there was some discomfort when I was getting some numbing, but nothing. I wasn't in pain. I remember laying there and the drill going and me thinking, wow, I'm good. And they were like, "You good?" And I was like, "I'm so good." And I was having the trip of my life. Like I remember thinking, "Wow, I miss getting high." Because because I haven't like taken any edibles since I got pregnant, basically, which was 2 years ago.
Mm-hmm.
And then I remember thinking, but not like in a like I need drugs to like be happy way, just kind of in a like tee hee ha ha, I want to hee hee ha ha more. You know, like I was having that kind of circuitous thinking with myself.
Hee hee ha ha more.
Time
That's
of my life,
our dogma.
and that's honestly like I don't think that I ever saw any sort of drugs as that was an option. Like I saw it as an extreme thing. And while I do think that, yeah, absolutely, there's overprescription and we can get into that conversation as well. Like I do think that there is like a very wide middle ground that we don't talk about enough, right? Like we don't talk about our friends who
Mm-hmm.
like, you know, take an edible or a gummy to sleep one night a week. We talk about our friends that we're like, oh my god, they're such potheads, they can't go a single day without, hit like ripping a bomb.
Yeah,
Like
they're hitting the Benjamin while they're driving, that
exactly.
kind of
They're
thing.
vaping like every fucking thing. Or we're like, oh, or they do nothing. And like those are the only conversations that we're having. So I'm curious to hear from you. Obviously, I'm sure that you were not pre-gaming our episode by getting high today. Unless you were, and then I would be like, damn, we really both committed for this. Not planned, by the way. I didn't even realize that I scheduled this appointment for right before we were recording. But then
A
when I was getting it, they were like deep breaths, and I was like, "Oh, honey, we're breathing deep already. Like we've been hit the nitrous." Or
we're
I mean, they,
chilling.
they said, "How are you?" And I said, "The nitrous is here," and they laughed.
A.
Hey, hey.
We're,
So
yeah, hashtag the nitrous is here. Hee hee. Hee hee ha ha more.
hee ha ha more. So I'm curious to hear like what your thoughts are on that, on like the potentially extremist, and like one or the other discussions about just drugs in general as well.
Yeah, as per usual, I'm having two competing thoughts about this.
I feel like
Like
at this point we need
when,
a code word for when you're having two competing thoughts.
yeah, I don't, what's like a fruit that's
That's
two very
oh,
contradictory things at the same time?
oh god. Oh,
Mm.
uh,
Tell
uh,
us in the comments. Let us know. We
dragon
need a code
blood.
word for when I'm Libra mooning.
Libra.
Libra mooning. Um, okay, so thoughts on extreme camps, thoughts on the, I guess, cultural dichotomy,
Mm,
the way that we perceive drugs.
yeah.
Where, I mean, it's similar to what used to be the thinking around alcohol, which I learned in school is a type of drug. It was classified as such in our whatever health unit, but since it's drinkable, I'm classifying it differently than stuff that you would munch, snort, or shoot.
Yeah. Munch, snort, or chew.
Or suck. Like you can, take a puff. Yeah, there needs to be some kind of alliteration there. But anyway, where there's like this perception, and it also depends on your age too. If you are in especially your early mid 20s, the time when you're supposed to be like like balls to the wall, going hard, going out, having a good time, there's sort of this expectation that you're doing a lot of experimenting and going to the movies on shrooms and
Mm,
going to Coachella and doing acid or whatever. Like there's like, what? You've never tried cocaine? Just like
100%.
especially with the party drugs,
Yeah.
there's it's like you were saying, there's an expectation that you either know someone who has been directly affected by the opioid crisis, or you have some kind of, you know, quote unquote soft addiction yourself, where you find yourself in social situations doing a lot of hard drugs, or you haven't done anything ever and you never will. And those kinds of people, those two varieties of human, either exist in the same friend group and it causes friction, or don't exist in the same friend group because they are so extreme one way or the
Hmm.
other, when that is really not true. Like for everybody, there is a middle ground where you can occasionally do something, or like you were saying, pop an Eddie on the weekend, or go through periods in your life where you don't engage in those behaviors, and then periods in your life where you do, and it's a lot more fluid
Yeah,
than we're led to expect or expected to enact in real life. So
100%.
that's my thought number one.
Yeah. Okay. What's your thought number two?
My thought number two is, and because of the job that I do and the fact that this account is public, I'm going to say this with, with a caveat here. I love drugs that you can buy at CVS.
Okay. Yes.
I love drugs for short, but what I'm specifically talking about are just like painkillers, Tylenol, Aleve, Advil, whatever. Like, I, for basically my whole life, have been a very staunch supporter of not being in pain when you don't have to.
Yeah. Not suffering through it.
And yeah, like, cuz you're just suffering for no reason when we have all of these really tools to ensure that we live happier, more pleasurable lives. It does not make sense to me. Like, if I get home from work and my neck hurts, and like I'm starting to not be able to, sit up, I'm gonna take some drugs. I'm gonna I'm not going to prolong my own suffering. And I have a lot of thoughts about like the effects of doing too many long term,
Hmm.
but in general, in this conversation about what we even consider drugs to be,
Hmm.
like, it's called a drug store.
Right.
And we're okay with using that language. Like, that's just what you call it. It's a drugstore. But then it's like, say no to drugs. Like, I have a whole soapbox about Dare, if you remember that.
So I never
that
saw
I'm
Dare, but I have an inherited soapbox from Dom about Dare. So we can for
ah
sure get on that soapbox in a minute. But I don't want to miss
yeah.
what you're saying about that because I have two conflicting thoughts on specifically your second point because I agree that we shouldn't prolong that. And I think for a while I was definitely in the camp of like, oh, like why take an Advil or a Tylenol like if it's not needed. But I do think that sometimes that can end up masking pain when we're just like when we're not thinking about like tools in a toolbox, which I think is a great
Mm-hmm.
analogy. Like I think that they are a tool, and I think that's about like. And I don't have a job that is going to be wary of me speaking this out loud. So to my clients, if you didn't know, now you know. I think this way about weed. I think that cannabis and specifically like edibles for pain management are a tool like any tool, I think people can over rely on it. Just like my mom was actually talking to me about how some people develop over reliance to Theraguns and like massage guns in general
Ooh.
because it becomes like the only way that they know to relax certain muscles or like to whatever. And so then their mobility can be impacted because they're only focusing on like that like spot of pain versus the whole muscle. Yeah, it was super fascinating to hear her thoughts as like a nurse that's seen people like especially towards end of life and like kind of like different rehab strategies. So I just think that we just need to have it's almost like the way I think about food, like a variety, a diverse, rich basket of tools that we can assess, like, hey, this thing is happening. What is best for this in this moment? And I'll give a great example. So, as we all know, I think at this point, if this is your first episode, you don't know, but it might not be. So, I hurt myself constantly. I don't even remember why last episode I was saying ow intermittently, but this episode is because last night I don't even know how to say this in a way that's not just horrifically embarrassing. So I fell off my own bed as a grown adult. I don't know. We got this new comforter. It's very slight. I don't know. Okay. Anyways, the point is that I fell off and um I like yeeted my arm backwards to try and catch myself on my nightstand, and I fucked my shoulder up, bro. So after, like, I tried to be like, oh, it's not that bad, and I tried to roll onto it. Oh my god, I felt that in my freaking teeth. So I was like, nope, can't do that. So I slept on the other side because I sleep on my side. And then after my daughter had gotten up for the day, when I was gonna go take a nap, I was like, okay, I'm gonna put some. I was like, I need to do something. So I have some like sports gel. So I used sports gel, went back to sleep. Sleep being a huge restorative piece of our toolbox that we don't
We
talk
could
about
do a
enough.
whole
We're doing
episode
a
on
whole
sleep.
episode on sleep. Just
Yep.
you wait. Um, but so yeah, I did that and then I woke up and it was just still so bad. So I ended up talking to my mom, who was a nurse. I think I mentioned that before. So my mom at first was concerned it was dislocated, which the perk of living with someone that's like a medical professional is that even if they're out
Free
of the field,
assessment of your
free
injuries.
assessment, but also they want to treat you right then and there. Like when I popped my tailbone, she was like, "Oh no, we're fixing it." So she said that. I was already gritting my teeth, being like, "All right, pop it in." It wasn't dislocated as it turns out, but it was like pretty fucked. That was not the words she used, but she was like, "Okay, you didn't pop it out,
That's
but
the diagnosis is pretty fucked.
pretty fucked." But she was like, "But you did definitely injure it." So she put on some topical pain cream. I don't even know what she put on, to be honest. I just trust her with that shit. But she was telling me, because my mom was great about like the educational piece about it. And to your point, right? Like we get these things at the drugstore, and I think sometimes we don't even know how to use certain things because we don't have the education or the training
Mm.
or like layman's terms for it. So my mom was like, "Hey, when you're using this type of medicine, you always have to wear gloves because it's absorbed through the skin. So if you're applying it onto somebody, it will absorb into your own skin, and that can kind of mess with your I don't remember what she was saying that it can mess with for her, like your like an
Your
overexposure can mess
sensory
with your
nerves.
no your heart or your blood pressure, one of those, something like that. So she was like, she just want to be like aware when you're using something like this. And then she put a lidocaine cane patch on it, and I was still feeling really bad on it, so I took some Tylenol, and then I got through most of the day with that. But I think for me, one of the things I have to be really wary of is if I don't feel anything, then sometimes I overdo it. I've done that before with my wrist or
Mm.
with my head, right? Like when my meds kick in sometimes really fast, I'm like, oh, I'm fine. And then a couple hours later, I'm like, oh my God, that was just like definitely not fine. But I do think like it's just a tool, right? It's just a tool. And I think that we should frame it as such and be really intentional about the reasons why we're consuming anything, really. I think that. But like when I think about things like recreational, like MDMA, let's say, I've never partaken, but I used to rave a lot. And as you know, actually, because I'm
Mm.
pretty sure I took you to a rave way back when. Um, and I remember just like how weird it is to be in that kind of space and be totally sober. For me, it was awesome, and I honestly, if I went to a rave right now in this moment, I wouldn't want to. I mean, I'm like thinking about it now, and I'm like, no, I don't want anything to distract me from that moment because I love the like communal high of like listening to live music and like all being in that zone and like just like like I still think about years later. This was like a decade ago, but I saw Tiesto perform a live cover of Yellow by Coldplay, and it was
Oh,
incredible. The lights and the oh man, like it was just one of the best things I've seen. But it was weird, and people would be like, damn, like, you're sober. Like, that's crazy. But I've always been super aware of the fact that I do have like I'm not gonna say an addicted personality, but I have a full send personality, meaning like I'm constantly trying to go to the next level of whatever it is. Like it can be literally so benign and I will still try to like push further. That's just kind of who I am. So I've always known it about myself that like I would be the kind of person that if I tried cocaine one day and it was fine, then the next day I'd be like, okay, that was fine. What's next? Right? Like it wouldn't stop
Oh,
there.
yeah.
And so my mom, when I was growing up, would constantly be like, Camila, if you smoke weed, the next day you will do crack, the next day you will do heroin, and then the next day you will die. Like that's the kind of image messaging that I got around drugs. My school didn't have a DARE program. And my mom had friends that she lost to addiction, drug addiction when she was younger. So she was like a zero kind of person,
Hyper vigilant.
hyper vigilant. And so I didn't try anything. Like I was like, no, no. Like the DARE program was made for people like me. No. Um, so I said no to drugs forever, unless you count alcohol. And if we're counting alcohol, well then, I did my fair share of tequila shots. But I had graduated college, like was living half in Texas, half in California when I broke my wrist in 2021. And what happened was I broke my wrist a couple months after I had donated a kidney. And when you donate a kidney, I've talked about it before, one of the biggest change I would say is you can't take any NSAIDs, any non-steroidal
Anti-inflammatory
anti-inflammatory
drugs.
drugs. Yeah. I was like, what's the acronym again? So I couldn't take anything. So it's basically my options were Oxy or Oxy. And I got a tablet of Oxy at the hospital, like right after I broke it. And it did nothing. I mean, it didn't even take the edge off the pain. And orthopedic pain is truly the worst of the worst, in my humble opinion. I would go through labor again. I would donate an organ again. I would do so many things before I want to break a bone. Horrific. And so I was in so much pain. And I remember calling Dom, like sobbing about how much pain I was in. And he was like, babe, the time has come. Like, you're 25 years old. Like, you need to just try some weed and help yourself, right? Stop suffering. But because I
Yeah.
was in California at the time, and California is California, like we DoorDashed effectively, not actually through the DoorDash platform. I'm not claiming that, but through a weed delivery app, some chocolate
Yeah.
and weed was what got me through like that injury. And
Whoa.
I don't even think I did. I took any. I didn't take anything. I solely rehabbed the injury off just edibles and like some edible chocolate post surgery. And then when I got back to Texas, where it isn't legal, Delta 9 gummies are available. So just Delta 9 gummies, and that's how I rehabbed the entire thing. So ever since then, I was like, oh wow, like I wasn't doing it for like, oh, I'm gonna try and whatever. Eventually, I had a night where I was like, what would it be like to not be in horrific pain, like, and just take a Delta 9 gummy for fun,
Mm.
you know?
Mm-hmm.
So I have done that as well, but for me, it really started out as like pain management, and it was really wonderful, like the effect that it had on my body and then my ability to relax and not suffer, and also not have to, be popping who knows how much oxy would have taken to actually feel the effect of it, right? Um,
Mm-hmm.
and and it worked wonders for my migraine as well for a couple years
Mm-hmm.
until I got pregnant, right? So I think that that's back to my high thought today of, damn, we're missing getting high. Like, it's just like really nice to take something and absolutely know that it's going to be effective. Like having a migraine, being able to pop a gummy and go right to bed and know that I'm going to sleep off the migraine. I'm going to be honest, I miss that
Magic.
girl. I miss that girl.
Yeah. Yeah. I miss that girl. I have a similar, not as traumatic tale, just like habits. Um, Alex and I smoked a lot our senior year, which
Oh,
is I don't know if that's surprising, but yeah, like we used to have pizza and just like even if you're a non-dairy person, because the non-dairy cheeses of the world have improved so much in the last few years, getting high and having cheese.
dude, Just like,
Oh,
let's be honest, get being high on any sort of weed and eating, period.
yeah, just eating
Eating.
food,
I
but like
once
for
thought
me
I
it was
was,
always salty.
well, yeah, but I once thought I was having like the best, like, French fry, like chili fry. I literally remember like almost crying. And it wasn't even the taste of it, it was the texture, like the way that it felt in my mouth was, could not get beyond how amazing
Otherworldly.
it felt. Yeah, I was just like, wow,
Mm-hmm.
this is the shit. So anyways, keep going.
Yeah.
So your
Yeah.
cheeses.
So, yeah, so we used to like, get high and eat cheese or whatever on weekends, but our senior year when I had one semester doing one thesis and the next semester doing the other one
Cause
and
she's that
the
freak.
paper
Wow.
overlap. Yeah, cause I'm freaky, super freak.
She's that freak.
One of
Okay,
the
I have to say that getting high and eating cheese might have to be the title of the episode.
parentheses 420 blaze it. I love that. Okay, getting high and eating cheese. Surprise, it's a mukbang. No, just kidding. That's the disclaimer. Disclaimer, not a mukbang. Don't be
Well,
creepy. Um anyway, it was a tumultuous year. I was just like burnt out, didn't want to like I had really bad senioritis and I still to this day I've had it since I was like 16, 17. It's been at least 10 years. I have a shoulder knot that's like close to my spine, but also kind of on the shoulder blade. And every time I've only gotten a massage a few times in my life, but every time I go, whatever person is massaging that part of my shoulder is like, oh wow, like it's just I don't know what it is. I think it's just where I carry all of my stress is in
yeah.
this one knot.
One this one spot your body focuses it all and is like here.
Yeah, and then if it gets really bad, it radiates up my neck and gives me a migraine. So it was to the point where it feels like a sunburn on the inside of my skin.
Oh
It
God.
burns when it's yeah. It burns us. It makes me feel like Gollum. like
Shouldn't folks? And she says she doesn't have anything to talk about for 28 minutes and it's just like, and then I feel like Gollum because of the sunburn inside my skin due to this really tight shoulder.
this is going somewhere, I promise. I found out in the peak of my stressful times when I didn't want to do anything and my shoulder was burning all the time.
Yeah.
I discovered that just like taking a couple hits from the bong allowed me to calm the fuck down enough to focus on writing my thesis. It reduced the pain so that I could focus on things that weren't that and just it was the perfect amount. That's the thing. I mean, anybody who has smoked weed more than a couple of times probably has horror stories, but it was such a helpful tool for me. And I got so accustomed to just like taking a couple hits a couple times a week that when after we graduated and I had a job and it was a different kind of
Hey.
stress,
Yeah.
and I tried to use that strategy again and it
Backfired.
totally backfired. Yeah, where it didn't hit the same. It was
Mhm.
like too much and I ended up having anxiety basically every time I smoked weed after that. It was like in the years like the pre-COVID and beginning of COVID that I would try smoking and it didn't work for me the same.
That's so interesting to me because so I've never smoked weed. Um, I am super sensitive to the smell of weed. It smells, everyone that ever said this to is always like, what the fuck are you talking about? But it smells sweet to me. I don't know how else to
Mm.
describe it, but it smells like it has this like sickly sweet, almost like cough syrupy kind of back smell. I don't know how to describe it other than that. But I've
Hmm.
always struggled with the smell of it. It's always been really unpleasant walking into a dispensary, being around friends that smoked weed. Like it never appealed to me. So I've only ever tried to smoke weed twice in my life. Once was with my cousin Danny. Shout out to Danny, but RIP. Shout out goes to this guy. Uh, anyways, and so he was like the family pothead, and I was like, hey, I want to smoke weed. And he was like, well, I don't really have anything. And I was like, okay, well, I'm not going to want to do this tomorrow. Like, I know myself. I've never wanted to smoke weed until this very moment. And so, like, it has to happen tonight. So, picture this, I'm in my Thea's tiny little apartment, and we're in her kitchen with the window open, and he's trying to drag up enough of a blunt for me to like, take a hit off of. There wasn't enough plot twist, but I'm like being out of the window. I told
Oh
his
my
mom about this
God.
maybe last year, with years after he passed, and she was like, "Oh my god, that is absolutely something he would he would have done is snuck you into the kitchen to smoke weed." And the other time that I tried to smoke weed, I was already drunk, and I was like, someone had like
Oh,
a vape
oh,
pen.
bad.
Somebody had a vape pen, and so I was like, "Yeah, sure, I'll try." And it something about the way what goes into my mouth. I hate the sensation. So I coughed immediately and was like, nope, I don't want it. And
Mm.
that was it. But I know that I'm just super sensitive to smoking anything. I swear to you, can't believe I'm saying this out loud, but I smoked a I smoked a joint of lavender, just straight pure lavender, crushed bud, rolled in a joint when I was in living in Cape Town, and I felt lightheaded.
Is
I was
that like a
like,
thing that people
no,
do?
no, just someone was like rolling joints, and they were like, "Oh, I'd love to add a little lavender to mine or a little whatever," and I was like, "Could I have a joint?" But like I was ordering a fucking mocktail, right? I'm like, "I'll just take one." No weed, please. And she's like, so you just want a lavender joint? And I was like, yes, please. So she rolled me a lavender. I swear to you, I was lightheaded. I was like, oh, wow, I'm sensitive. I don't know what it is about smoking, but I just can't do it. And then the only other time I've tried to smoke anything, I tried hitting Dom's vape. And for those of you who don't know and aren't deeply familiar with Dom's usage of nicotine. Dom smoked cigarettes for like a decade, a little bit more than that, and then changed to vaping. Actually, as of last year, Dom does not smoke anymore. Yay! Everyone clapped to him.
Woo!
2/3 of his life.
Yay!
Um, exciting. We love that for him. Yeah. He no joke. His doctor asked him how long have you been smoking, and he said 20 years. And she said you're 30. And he said, yeah, I know. Yeah, he started smoking when he was 11. Anyways,
Whoa.
yeah. Anyways,
Okay. R.I.P.
um,
Dom's lungs.
yeah. But I once was like, oh, let me hit your babe, and he was like, babe, are you sure? And I was like, yeah, let me go. And he was like, okay. And dog, when I tell you, I started to hit it, and again got so lightheaded, I had to sit down for like 10 minutes. I was like, oh my god, I can't. So all that
Wow.
said, all that to say, I don't smoke anything because I can't. So I prefer. I know I'm in the minority with this, but like I honestly I prefer edibles. I only I only fuck with edibles because smoking is not pleasant for me. It ruins the whole experience. I hate it, and I've discovered that when it's not for pain management, when I'm not like, hey, like let me take gummy and live my life, um, I just like a little hee hee ha ha, like little uptick, watch a movie, eat a snack, and go to sleep. For me, it's
Mm-hmm.
not a social. Like, yes, I've done it with like a friend or a cousin or whatever, like sitting next to me, but I don't. It's not a particularly like I don't want to go out and get high with a group of friends or like go,
Yeah,
420
it's
on
not
like,
an upper for you.
no, it's just like, yeah, just like, and I think part of it is honestly, you can attest to this as my friend, like I'm high on life. And I know that sounds so like straight edge kid of
My
me.
natural high is life.
Is happiness and gratitude. But like truly and honestly, like I have a fuck ton of energy. I am really
Confirmed.
goofy. I'm goofy as fuck and extroverted as shit on a normal day. So I feel like if anything, things like weed, things like alcohol, they make well, alcohol's a little bit different, but weed specifically, like it chills me out and just makes me giggly. And like that's fun for me,
Mm.
but it's not necessarily something that I want to like pursue like in a wider social setting. Because like I'm usually
Mm.
like laughing at nonsense just in general as a person.
Yeah. Yeah. I
And I
feel
think that
that.
that speaks to the motivation, right? Like because addiction, I was saying a bit ago, like I tend to have that like full send personality. But I also know that addiction runs in my family. I have alcoholism that runs through part of my family. And I've had enough exposure to like Dom's life story. Again, for those of you who don't know, I'm just kidding. But Dom,
We'll get him on the pod. Bella wants to be on the pod
he'll
next
he'll come on.
season.
He'll come on.
Yeah.
He'll talk about his messes. Just kidding. But he uh he started smoking when he was 11. He went to rehab when he was like 15. Spent a year in rehab. Did like an
Woof.
entire year of high school in rehab, came out, drank heavily, and then stopped. And now he's the kind of guy where 7 years ago, homie did one shot of tequila and a Mike's Hard Lemonade, and then was like, "Hey, yo, baby, I will tell you how much I love." And I was like, "Girl, we're going home." Someone was like, "Oh, we just got here." I said, "No, I know, but he needs to go home." And then when we got back to my apartment, this was at Linfield, by the way. We get back to my apartment, and he says to me, "Babe, I'm gonna be sick." And I said, "Baby, get into bed, sleep it off." It was a drink and a half, maybe. He said, and I quote, "No, I'm just going to spend the next couple hours in the bathroom. Don't wait up." I'm not kidding you. He waited 2.5 hours at like 1:30 in the morning. I hear the most pitiful cat like, bleh. And then he gets into bed and he said, "See, I told you I was going to be sick." It's like, girl, you made it sound like you were a white girl wasted and you needed to yap your life away, not drop it, probably spit into the toilet and then go to sleep. Um,
Wow.
yeah.
That's your husband.
And I married him. Oh,
Ooh.
that's my man. That's my baby girl. Um, which side note, so many people don't know that I called Dom baby girl. That the other day I answered the phone and I said, "Hey, baby girl," and someone was like, "What?" And then I was like, "Oh, sorry, it's my husband." 1 second.
Oh yeah, baby girl, girl,
Yeah,
dude. Yeah.
I feel like I call him all variations of just the word girl. I mean, I call most
Yeah.
people girls. So, anyways, yeah, I feel like I have enough exposure, and I like to say that Dom is like my drug dictionary. Meaning, if I ever have a question, like, what does it feel like to do, honestly, meth? He can tell me.
Mm.
He can tell me what it's like to do crystal, what it's like to do shrooms, what it's like to drop acid, what it's like to do like literally anything under the sun. He can tell me what it is. So like I don't really have any curiosity in that.
Yeah.
I'm good.
Wow.
And I think that to your point about Dare and why it's not
Oh yeah. I
effective,
got things to say about Dare.
I'm sure you do, but Dom's biggest thing is like it actually provides less education and more curiosity.
It's like
Where
abstinence.
yeah,
Like abstinence only sex ed.
exactly. And so like his big thing is like education is really important. And I will say that like of all of our nieces and nephews on his side of our family, like I don't think a single one of them has any interest in trying any amount of drug. Not that they've like quizzed him extensively, but they know, especially the older ones, that they could, and they could ask him about like whatever, and they all know that he used to, and when they're little, right, like do bad stuff, and then they get older, and then they actually know what that means. But, um, yeah, I think the more exposure, the more open conversation, and the more just like dialogue that you create about anything, the whole point of our pod, but specifically on this topic for younger folks, the better because it demystifies it, right? You get away from the look
Yeah.
back and die and more into like, all right, this is what it really looks like and the real
Mm-hmm.
consequences. And it was one of those things like Dom has a former friend who had a surgery and got addicted to Oxy. And I saw that guy like after that he was trying to get clean. And it was one of the things that I was like, damn, I don't want that, So I think
Mm-hmm.
more education can't hurt. And, and that's like Dom's biggest thing. But yeah. So anyways, I don't know what the conclusion of that whole point was other than to say like, I think it's important to talk about it and to have more
Some people
dialogue
like
on
smoking weed. Some people like to pop an Eddie.
popping Eddie's all day. You know what's funny is I've become like the unofficial, like, not actually FBI if you're listening to this, dealer of the family because I have a couple family members that have found edibles to be really helpful for their pain. And
Mm-hmm.
so they'll be like, "Hey, like, can you run and it's been hilarious when I was pregnant, and even now, because I'm still nursing, right? So I'm not consuming any sort of edible now, but I'll go to the dispensary for my family members that need it, and I'm like, "Hey, it's me, not for me, thank you." It was really funny one time when I
Fighting the
rolled
good
up in
fight.
there, like 8 months pregnant, and they were like, "Ah," and I was like, "No, no, no, it's for other people. I'm just picking up."
Sure, Jan. Yeah.
But it is crazy to me the commercialization. You know how we talked about like protein maxing and like protein soda and stuff. Just how much
Mm.
like the CBD sodas and the like
Oh, yeah.
all
Like
that
as
has become a
alternatives
thing.
to alcohol. Yeah. Or even just like hemp water. Like I don't know what that's supposed to do,
I don't know,
but
but I mean, like, I guess live your life, figure it out, whatever works. But I feel like sometimes, again, like we were saying about the protein stuff, right? Like, I think it has a place in our toolbox, and I think we should be very aware of why we do anything.
mm,
And it just, and I know that we will likely get into a larger conversation about alcohol as a concept, but I feel like some of those drinks are marketed to moms in the way that like wine culture is marketed to moms. And the like need to relax
yes.
after a long day with your kids, just drink my
Have a
tonic,
CBD
whatever.
water.
Yeah. And it's
Yeah.
just like, okay, like, yes, and like, yes, I do think the mom should relax. And no, I'm not judging anyone who, like, that's their way of relaxing. But I think that sometimes, like, again, it covers up, like, what were we talking about with the Tylenol? It covers up, like, the core issue, which sometimes it's like a mom that's unsupported, or sometimes it's a mom that needs something else that, like, yeah, it might zen you out or whatever. You'll get a nice buzz for it for an hour, but like, it doesn't address the other issue. And, I guess it's not my place to say, like, what people need. But I know for
Mm.
me, anytime that I have the thought like, "Oh, I need a drink," or "I need a to get high," or just want to
Something
get
to
high
take
and
the
not
edge
whatever.
off.
Yeah, anything like that is like a very red flag for me that I can't consume anything that
Mm.
that will affect my head because I do not want to become over reliant on those things, and I want those things to be something that like I use for enjoyment and for pain management or whatever, and not for like, and not in the pain sense. I'm not talking about like if you're chronically ill and you use weed and you're like I need to take the edge off. No, I'm
Yeah.
talking about
No,
like
please
specifically
please take your prescription
for
drugs.
like emotional wellness. Like, oh, I just like
Mhm.
I'm so sad, so I want to numb out. I work really hard to not numb out, and I think that those sort of things are very easy for someone like me and my type of personality to get into and be like, oh, it just like, it helps me like, not think about it. And,
Mhm.
like, yeah, but that's also distracting when what I need to do is actually like think about my shit or whatever is going on or like breathe it or whatever.
Yeah, process it. Yeah, I once again have two competing thoughts, and I'm considering pineapple because they're spiky on the outside but sweet on the inside. They're
Okay. The problem is
competing
upside down
textures.
pineapples are for swingers. So I don't, know if I just want to hear pineapple shouted several times an episode.
Oh no, another gay thought.
I don't know if swinging itself is gay, but
On this podcast. It can be
I mean,
if
yeah,
you're
so
doing it
can
right.
every. All right, all right, all right, all right.
Now I lost the train. Okay. Um God. What did you just say? Oh, emotional numbing.
Yes, drugs for the purpose of
Okay.
emotional numbing.
Okay, yeah. Have you seen those memes on Instagram or like clips of people being like, after a hard day at work, I really just needed something to take the edge off, and they're
And
like
it's French
holding a
fries.
pickle. Yeah, it's
No,
like
but
French fries or a pickle or something.
my favorite is the one that's like when you've had a long hard day, but you don't smoke, and it's a guy holding a thing of French fries, like sighing against a wall, and like leaning his head back and just like popping fries. And I'm like, yo, popping fries all night and day, bro. That honestly, for me, that shit hits. That'll take an edge off for sure.
Mm-hmm. Yeah, just something to do with your mouth, like Trader Joe's pickle chips.
Ooh. Have ever had those? I
Oh,
don't think I have.
I don't
Have you
know if
given
they're
them to me?
vegan.
You might have given them to me.
We
That
had
sounds.
pickle popcorn,
Oh, I was thinking about the popcorn. Sorry, Olivia has
which is also
pickles
good
in many varietals.
for consumption only.
Jesus.
LOL. Hey, it's getting close to my bedtime. I can't control what comes out of this
Olivia,
mouth.
Olivia's getting progressively more suggestive every episode. Last episode, it was, this is a really horny song. I'm like, okay. All right.
Well, my natural high is
That was Olivia's brief. Thank you for our message from our promo of our future episode, the sex episode. Thank you. Now back to our regular programming. Drugs.
yay. Hey FBI. Oh my god. But yeah, no, like emotional stuff. They're as a girly who's done variations of therapy and counseling and, dark night of the soul, inner child work, yada yada. It's a little too early for me to get that woo woo. We're going to save that for season 3. Olivia's woo woo nonsense.
Ooh. Season 3 is going to be
But
popping. Yeah.
it really, ooh, damn. Our listeners in Ethiopia, Cambodia, and Albania are going to be
Olivia's
thrilled.
very thrilled to tell you all how many countries our pod is now listened to. So she's been waiting all episode to be able to throw a little reference here or there. In case you're wondering, it's more than just 3 countries,
It's more than 10.
but not quite 20. We have
Did you guess it?
like 10% of the world share at 17.
At least one person in each country of those 17
And so
listening.
to you, if you are in not the US, I mean, okay, if you're in the US also, I mean, shout out to you because you are
And
listening,
Mexico.
and we appreciate you. No, but I was just
And
gonna say, like,
Vietnam.
see, now she's gonna run through the whole. She's gonna pull up the screenshot I sent her before we recorded of all the countries where
I
we're
know, like we're gonna post it on the gram.
Honestly, I'm down. I'm stoked about it too, and more on that at the very end of our episode. Let's finish our thoughts on the drugs, and then we can go to general thoughts about the world. Ow.
Yes. Okay. So emotional needs, sometimes you really do just need a substance. As a person who used to smoke weed and who used to drink, I understand that, and I am not judging anybody at all who uses, as we've said, those tools in very specific situations. But a lot of the time, especially if you are a person who is very like go, 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 if you're busy, if you spend a lot of time online, if you're a person who finds themselves just like overstimulated a lot of the time,
Mm-hmm.
then maybe what you need is less stimulation.
Mm,
That there's my hot take of this episode is maybe we don't need more things. Maybe we
yeah.
need to
Less
take
thing.
some things away and just like lie down on the floor and stare at the ceiling.
Hmm. Hmm. Or
So,
like be in a dark room, a dark quiet room.
yes. Yes, a dark quiet room. Take a shower in the dark. That's
Oh,
trending now. Dark showers.
dark showers.
Dark showers. Now it's cabaret. Dark showers.
Showers. Da, 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 da. With my fuck shoulder, so it's just one shoulder moving. Joyful.
Love that visual.
Yeah, 100%. Yeah, I think
Yeah.
overall, I think our biggest message with this one is it doesn't have to be all or nothing, like everything that we talk about on the pod. And we should be educated and go into things like with eyes wide open and with true awareness of like the effects, not in the like read every study about acetaminophen and its long term effects on the liver, but like
Tylenol causes autism.
right, but like
Blech.
aware of like what I mean. You'd be surprised just how often people are like, oh, I just popped some Tylenol, and you're like, oh, how much? And they're like, I don't know, a couple, and I'm like, oh,
Pray for your liver.
right, like you should probably know the dosage, or and as a pinch hitter, go for it. But if you find yourself reaching for certain things over and over and over again, especially when it comes to pain, like make sure that you're also doing the kind of like investigation. And I say this as a chronic illness girly who understands the medical system is not one that's easy to navigate, not one that's built for like long term pain management, and like chronic illness is hard shit
In this country.
for sure. However, I do think that it's worth exploring, like even if it's very challenging, like it's still worth it to give it a shot. To like look for the doctors that are gonna listen to you and don't underestimate just how exhausting long term pain can truly be. There is a great and I will shout out some of my other tools right here. I think that acupuncture is a wonderful tool for pain management.
Ooh.
Um, I love acupuncture, and the reason I'm thinking about it right now is that some people don't know that nowadays, like if you're in the Bay Area and you're in the Kaiser system, you can get a referral to acupuncture, and there are clinics that you can go to for pain management, for long term pain management, and they have all these posters. And I remember the first time that I went to one, and like it's very like community acupuncture is you sit in an armchair and you only get needles like elbow down or knee down, so it's like very like not you're not like taking off your shirt or anything.
Non-invasive, more private.
Yeah. Um, but you sit just like in an armchair in a room with other people, and you go in a recliner and you like just get your needles, chill out for an hour, and then you're done. But I remember the first time I went and like seeing a poster on like the effects of long term pain and just how much pain
Mm.
robs of focus and of just like how interruptive pain is. And so again, definitely use all the tools at your disposal. I'm not saying to not. And also make sure that, if you are dealing with like significant pain that you're using these things for, like if possible, if accessible to you financially, all the things, like I encourage you to also, work with your care team to assess kind of like what's going on, and that way again you can make the most like informed decisions and kind of know like what's up. Um and you can develop better tools for yourself.
Yeah, yeah. You can become a more knowledgeable person about the system, the tools, your body.
Yeah.
It just is great
Yeah,
to talk to people who know the industry.
right. And I think I mentioned this on our last episode, but like I have osteoporosis in my lower back specifically. And I only discovered it because after the last time I broke my wrist, the third time I broken my wrist, by the way, I had a provider ask, for the first time, someone in a follow up asked me how many times I'd broken a bone. And I told her, and she was like, "You're how old?" And then I told her, and she was like, "That's not normal. Have you ever had a bone density scan?" And I was like, "No. Is that a thing you can do?" And she was like, "Yeah." And so I got a bone density scan and it popped with like normal readings on my femur, normal readings on my hip, but low density in my lower back specifically. And so now I know that, right? And now I know that it's one, I'm not fucking making up the fact that my low back hurts. Yeah. But two, like I can address that. Um and just yeah, always like stay very aware of why you're reaching for something because sometimes it's like a short-term benefit but at a very long-term cost.
Mm-hmm. Yeah, like there was a time, and it was right before COVID. It was that fall and winter leading up to the world shutting down that I did something to. There's like a muscle in my lower back, right above my butt, that I tweaked as a senior in high school, and it hasn't been the same since. I don't know exactly what's wrong with it, but like every few years it'll just be like,
Hey.
that's weird. I
Yeah.
maybe should do something about that. And it got to the point where it was like so bad that the pain was like radiating through my stomach,
Oh,
and it like felt like period pain, but it wasn't, and it
oh
was
God.
so bad. I could like barely function. So I was taking a leave every day for months. And then after that, it was a couple other factors too, but I had really horrible acid reflux after a while.
Oh,
And what can cause acid reflux? Taking too much a leave for too long a time. So if you're experiencing, like Camila was saying, if you're experiencing a certain amount of pain and changes to your lifestyle are not working, and you're taking a lot of painkillers without being prescribed them, like maybe check that out so
yeah.
that you don't have any other symptoms.
Adverse
And I'm not
effects.
saying that I'm not a doctor. This doesn't mean that this would happen to you
Yeah,
if you're taking, whatever other thing all the time. But it's a thing that can happen. So
hmm,
like be aware of what's going on in your body and the root causes of these feelings and these symptoms, and make sure that in treating one thing, you're not creating
for
other
sure.
problems.
For sure. Yeah, I mean, we see that in the migraine community with like Excedrin and like an overusage of Excedrin for that. And again, like everything, I did not think this was, by the way, the direction we were going to take this episode. So I'm like, I'm always
420 blaze it.
very, very pleased and surprised at where we go. But um, what was I going to say? Yeah, like overconsumption of Excedrin can lead to like some adverse effects. Wait for it. I had such a thought. Oh, but like everything, everything's cyclical, everything evolves, right? Like I'll share with my migraine stuff. When I was pregnant, I had that weekend I found out I was pregnant. Actually, I had a 3 day migraine, COVID, and I found out I was
Mm.
pregnant. So I couldn't take any edibles. I was just like laying in my bed wanting everything to stop. And so during the course of my pregnancy, I started a new migraine med, and then I didn't need it because being pregnant, a lot of my migraine stuff I think has to do with my hormones, and so do my doctors. I love how every episode we find out more about Camilla's health, but I didn't have any migraines from like month 4 and on, and about six
Wow.
months postpartum. So I had like a good year, no migraines. And then my migraines started coming back. And the medication that I was taking, it works, ugh, but it makes me super nauseous. So I have to take another med to counteract the horrific nausea that I get. And now
Mm.
it's no longer effective 100% of the time. So like sometimes it'll work, and other times I'll still be in pain, but now also be nauseous and feel horrible. So I have a
Ugh.
doctor's appointment this week so that we can talk about like different pain management. And honestly, I'm at the point now where like yes, I would love to continue. Oh my goodness. Sorry, my cat is a menace to society. Yes, I would love to continue nursing my daughter if everything worked out. And also, like, if I get to the point, and if we are at the point where, like, I actually have run the course of, like, these types of medications and I have to go on a wait list to see a neurologist or whatever, like, I'm very open to no longer nursing if that means that I'm able to reincorporate edibles into my pain management, and that works
Increase your
better.
quality of life.
Right. So like again, everything is everything evolves,
Everything's
everything
connected.
changes, everything is available, and we are not here advocating for like there are people who for sure advocate on getting high while you're pregnant and things like that, and that's not what I'm here to do on this episode today. But I am here to tell you like you're if you're a mom and like you find yourself having like similar issues of having pain, but you know, you're nursing or whatever. I think there's a lot of shame that goes into being a mom that consumes weed in any form.
Mm.
You know,
Mm-hmm.
like I would just encourage you to remember you matter too. And consuming weed, it doesn't make you a bad mom. And it doesn't make you, just like having a glass of wine doesn't make you a bad mom. If you're doing it every day and disconnecting from your kids altogether because you can't like be present at all without the use of substances, then I would say that there's other stuff going on, right? But it doesn't have to be zero or that. There can be middle
Mm-hmm.
ground, and there can be like you seeing a benefit to something that exists and is legal where you are. Again,
Yeah. Caveats.
caveats, asterisk, asterisk. But you know, there's at this point in time, it's the year 2026. There's like CBD. Again, there's CBD soda that's I'm pretty sure sold across the entirety of the U.S. So
Mm-hmm.
do with that what you will. What an
Yeah.
episode. What an
Wow. Really empowering note to end on. You matter. Take drugs.
you matter, D-Dug. Okay, I do have to share a very funny story of the one of two times in my life that I've seen cocaine in person. FBI, if you're listening to this, no, I did not partake. Here we go. Okay, so one of those times I was at a party and people were like, "Oh, like, do you want any coke?" And I said, "No, I'm good." But then they brought out FBI is like, but then no. Then someone brought out a package of Costco Dolma, like Costco sized Dolma. If you've never had Dolma, you're fucking missing out. We love Dolma in this house. And I said, I don't want your Coke, but I will take your Dolma. And I proceeded to eat the majority of Costco sized Dolma.
This is marinated rice wrapped in grape leaves, by the way, for
Oof,
those who are not familiar
so
with Dolma.
sexy. Just thinking about it. I fucking love Dolma, bro. I can crush a basket of Dolma. Um, so that was one of the times. The other time, I remember thinking, wow, y'all are dumb as hell because how I went, I'm at a party. Okay, so mm, this must have been the year before you and I met, and the year before Dom and I met, something like that. Anyways, I matched with this guy on Tinder. He's like, come through to my apartment. It's like this becomes a whole event, like a whole lore piece, because I take a friend with me and it turns out that it's in his apartment, but we have to park at like the community center in their apartment, whatever, and then like walk with these people over to his apartment, whatever. It's like mid party. They're like,
Hmm.
"Oh, do you want some?" And I'm like, "Oh, some." And me being me, I'm like, "A snack? Like, what a good host." I turn and it's just a plate with a pile of Coke on it. And I'm like, I'm good, right? Because especially that point, I've never even like smoked weed. And the friend I was with was like, "Oh my god,
Whoa.
is that real cocaine?" Like we look like we've literally been dropped out of like a fucking. We've never been outside the house,
Well,
right? No, wait, but hold on, because the plate was white. right? So then my second thought was,
So then you couldn't see.
who puts a pile of little wicker play? And so then I proceeded to watch this guy like do like 4 to 6 lines. And yeah, told me it had to be like a song. Then I bring this up once and like no, this was before that. I remember being in a college class. People were talking about Coke, and this one guy goes, "Oh, but I only do Coke like recreationally." And I was like, "Wow, we have evolved on our thoughts about social dynamics to the point where we're talking about doing Coke recreationally."
That, okay, I will say on that note about piles of Coke at parties, just final thoughts on the DARE program.
Oh yes, please.
Hashtag say no to drugs, blah, blah, blah. I was under the impression at ages 7 to 10
Yeah.
that drugs would be much more prolific, easier to get, and forced upon me a lot more than they were in my high school and college experiences. I was expecting that I'd be having to say no to
You'd
Coke
be
and
like,
heroin
"No,
left and right.
stop! Like, take that needle away." No, I for sure feel you.
Yeah.
I feel you on that. I went to a party, my first party when I was like 13, and I remember my parents being like, "Camila, if there's drugs, you have to say no." And the most that happened at the party, by the way, the only party I've ever been to, not to toot my own horn or anything, but the only party I've ever been to where I wasn't in the middle of the dance floor the whole night because I was 13 and awkward and didn't know anything about myself at that point. But I just remember being on the outskirts and the song, "You're a jerk, you're a jerk." That just come on. And I just remember people being like, "Do you want to learn how to jerk?" And me be like, "No." So I was like, there was no drugs, but there was a lot of jerk.
Say no to jerking.
Oh, oh, what a fun.
Incredible.
Incredible, enchanting. I do want to give ourselves a shout out because we are over 340 listens for the pod altogether. We're in 17 countries. I know, Star. You're so cool. No, but actually though, like, thank you so much for listening. No joke, when Olivia and I first pitched this to each other in our bizarre post
Reunion
reconnection lunch of like, what if we had a podcast? I don't think I had any idea of what this project would turn into. And wow, like that's 300, not 3 million. I think that the 300 to me matters potentially more just because it really is such a such a like labor of creativity and joy and outlet for me and Olivia to just rediscover our love of discourse in this media.
Yapping.
Yeah, like we get to yap and y'all are listening to it. Like the only thing that would make this better was if we were getting paid. And like not to say that that'll never
We're
happen.
getting there.
But even if it never does, like this truly is such a highlight of my life. Can't speak for Olivia, but I love doing this. I love bringing this forth into the world, and it's really helped me bring back my joy and my creativity in so many fun ways. So, yeah, thank you so much for freaking being here. And if you're in one of those
everybody.
16 non-US countries, like what the heck? Like,
Where are you?
I'm Mrs. Worldwide, baby.
Hey.
Next, we're dropping our collab with Pitbull.
Pitbull.
Dude, Pitbull. Okay, last random tangent. Pitbull to date, Pitbull and Muse, best live shows I've ever seen. Like,
Really?
Nick, if you're listening to this, because of course my high school boyfriend would be listening to my pod every week. I know I've shouted you out in the past, but
Die Hard.
those like ninth row seats or whatever that you got us that one time to see Pitbull and Kesha, by the way, she opened for him.
Oh, hell yeah.
Was
Oh my God.
still like on my top like musical experiences of mine. No, dude, Pitbull is fucking crazy. Everyone's like, oh, how does he do it? Because he's feat on so many songs. Bro, the way that he played the song behind him, and he would jump in on his verses, but he would have the music video playing in tandem with all of his background dancers. Like the energy he brought to this. I remember, not to hate on English speakers by any means, but there were these two like hella white people right behind me, and I remember them being like, "Oh my god, I don't even know what he's saying, but he just makes me want to dance." And I was like, represent Mr. Worldwide out here for the people. Like it just, he's
That's true. Shout out to Pitbull.
so joyful, so joyful. So yeah, Pitbull, you're the man. And also, if anyone out there is listening to this and you want to go to a Pitbull concert with me and we wear bald caps, I'm so in. Because
I love that trend. Can I just
wait, Olivia, can
I
we do
find
this?
that so funny.
Can we find a Pitbull
Yes.
concert?
Yes.
Okay, all right. I'm looking it up.
What do you mean?
Um,
Great segue into our songs of the week.
boom, boom, boom. All right, go for it.
All right. Similar era to Pitbull's
Okay.
peak popularity. I had a student while he was doing independent work in class today sing Low by T-Pain and Flo Rida under his breath. And he did not have the words right at all. But he had the spirit. He knew when Low was coming. So, Low. And then the other one, my neighbor, coworker, friend, JP. If you're listening to the pod, shout out to JP. We carpool to work in the morning, and he's always playing emo music. So I've had Misery Business stuck in my head for about a week.
I love that for you. I will say that I met my freshman year high school boyfriend to the song Low by at the homecoming dance. Do, 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 do. I also fucking love the meme where it's like a girl's face, but she has 4 legs, and it says apple bottom jeans, boots with a fur, and Nike is on the other two. Like, who was... You've never seen that meme that it was like...
I've never seen that.
It's like, who was Florida talking about? Because she would have had that for
Apple bottom jeans, boots with the fur.
and then Nikes with the string.
Was she wearing one on each foot? Was it 2 different girls who were both wearing apple bottom jeans but different shoes? Please explain.
I have a question. So, yes, also on the note of T-Pain, I will tell you that I played, I know I mentioned this last week on the pod, but Miguel's Tiny Desk. My dentist today goes, so what kind of music, before he even finishes his sentence, I'm like, the Miguel Tiny Desk. He's like, oh, that's specific. Okay. Puts it into YouTube. He was humming it the whole time. Like, I felt so proud. I was like, oh, I won dentistry today. And he goes, this is like a top patient pick. And then he was like, I feel like Miguel, like, I've never had the pleasure of seeing him live, but you know who's also really good? T-Pain. And I was like, oh, T-Pain, like with my mouth full.
tell you.
And he was like, oh no, I've seen T-Pain live. Like, that was, and so then me and my dentist got the bond over seeing T-Pain live. So another one that I'm totally down to see again, because Olivia and I saw T-Pain together some years back. Love that. So my 2 songs of the week, very different vibe. But Can't Help Falling in Love, specifically the version that plays in
Crazy Rich Asians?
yes,
That one gets me. I'm
Nicki
so sorry
Granic
for
one?
screaming into the mic.
It
That
was
gets me every time.
oh, it's just the visual. I love that movie, but yes, that song has been on repeat for me. And then, oh my god, what was the other one? I told you earlier.
Do You by Miguel.
Oh yes, in line with the theme of the week. Do you like drugs? And me too. What you gonna do? I will say, if you are listening to this and you haven't listened to the Miguel Tiny Desk from that I mentioned last week, again, go listen to it because like that song on acoustic. Oh my god.
Uh-huh.
What you gonna do? So we'll end with that. Have a great week. We will see you next week for our
Thanks for being
penultimate
here.
episode of the
Ooh.
season. Crazy. Because we we're coming up on the end of the season, so don't cry yet. We're not done yet. We have 2 more to go. Love you so much. Leave us a freaking
Yes.
review, or else Olivia's
Leave us a
gonna come for
review,
you.
dear God. If you leave it, if people comment on our stuff, we'll drop some more photos from our photo shoot that we did.
What do we do? We're like, we'll show you some more of our pics. We'll drop the shoe if you leave us a. But seriously though, if you're listening to this, like, we've covered, like, what the fuck? Like, you gotta make us legit. Like, we're legit in listens, but we are not legit in reviews. I'm gonna have to start, like, I don't know what I'm gonna start doing, but if you got a text from me this week and it's like, leave me a review in all caps, you know why? Because you didn't.
You know why? Yep.
Stay messy,
All
and we'll see you next week.
Mwah.